How you doing? My name is Noah Peltier. From my previous video, I have changed my interest from physical therapy to child psychiatry, which a company named David Lawrence Centers for Behavioral Health, I believe will be a good company for me to be able to join with the interests and aspirations of being a child psychiatrist. So as you already know, the company name is David Centers for Behavioral Health. History behind the company was founded in 1968. Originally started as a nonprofit organization providing behavioral health services in Southwest Florida. They have different centers. Just like the previous job I had put out there, it has different locations, so I'll be able to travel depending on what location. If I were to apply and get an offer for a job opportunity / offer from, I'll be able to travel to possibly a different location. The mission for this organization is to provide life-saving and life-changing behavioral health care through education, prevention, intervention, and treatment available to all. The vision is to lead transformational care so each individual can realize what is possible. They're evolved from offering more limited services to a comprehensive system, inpatient and outpatient services, residential services, community-based services for children, adolescents, adults, and more. Their industry and the market that they cater towards is behavioral health, mental health, addiction, and other services. They also cater towards nonprofit organizations, so they collab with others as well. Behavioral health science services, for both children and adults. They seem to be a leader in the region in terms of scope and recognition. They face competition from other mental health providers. But as a nonprofit with a long history through 55 to 66 years of work, and with large community / government funding, they have established strong presence in their field and in their career. Customers have reviewed this as public reviews are some saying that through more limited in scale and the sources I saw, they received positive responses for expansion of services, caring staff, and community. For example, the community has given philanthropic donations. They have given millions of dollars when it comes to gifts and donations. In recognition of their work, they have given millions, but they have also received millions when it comes to what they have donated, but also to people donating towards the work that they are doing. Some complaints appear that around capacity limits, waiting times of service is a long period of time. Typical in behavioral health, though, and in behavioral health, to gain mental health services, especially when it comes to children with autism and different things of that nature, sometimes getting the help they need can take a while just because of the limited staff and faculty in this environment. I saw hints about waiting for mobile crisis teams, etc. Not many detailed negative testimonials, but overall, it just seems like they have a fairly good reputation and they hold a great statue in the mental health space as a nonprofit serving broad behavioral health needs. They have a different variety of services, varying from inpatient, outpatient, residential care, community-based services, prevention, intervention, education, and many more for adolescent, child, and adults. They also provide holistic treatments, which I would love to be incorporated in my type of therapy, which is art therapy, yoga, meditation, and animal assisted therapy. For me, I'll probably want to do more so, not yoga therapy, but physical therapy and meditation. In my services, when working with mental health, the social responsibility, because they are a nonprofit organization, services for public behavioral health is in itself a mission-driven service. They provide services to underserved populations, children, substance abuse as well, and mental health crisis and care. They have strong philanthropic support, which they have gained large gifts, community foundations, grant money, and different things of that nature. They are expanding access, new facilities, mobile crisis teams, and expanding throughout the nation. They work to include prevention and education, which are upstream, not just treating illnesses. Overall, I believe they are a great organization. They are expanding, they are nonprofit, and they are all about the causes of working towards people with mental health, especially children and adolescents. Um, yeah.